Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week. Looking forward to your Thursday, and then you're one step closer to the weekend. Hope you're looking forward to a nice June weekend coming up. Coming at you today on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Thursday, June the 10th, 2021. Going to look at 6 areas of health and wellness. Somewhere around this video you can read through all 6 areas. If you'd like a copy or you have any questions, you can DM us on social, send us an email, or give us a call here at the clinic. We're always happy to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, you may just find some of the information we share based on the latest in research and literature interesting, and or just stimulate your own thoughts about your health and wellness for the day and the coming weekend, so that you can keep your decisions, actions, and choices about your health and wellness at the front of your mind. Keep supporting that good journey that you're on with taking care of yourself and those around you. Keep up the good work. Always time and effort well spent. The European Heart Journal, Acute Cardiovascular Care, May 2021, talked about atypical heart attack symptoms. While chest pain is the most common symptom of a suspected heart attack, 1 in 4 heart attack patients may initially experience less common symptoms such as breathing problems, extreme exhaustion, and abdominal pain. Most concerning to researchers is that the 30-day death rate is nearly 4 times higher in the absence of chest pain, which suggests atypical heart attack symptoms tend to be ignored or taken less seriously. If you notice that your body is sending you some kind of message and it doesn't seem quite right, always good to pay attention, monitor that, and or seek some advice. And don't just think it'll go away or it's not that bad and you can live with it. You just never know what might lead to something else or is a sign that something more significant is going on. So it doesn't hurt to err on the side of caution and just look into it a bit for your own health and well-being. The journal Gut in May 2021 looked at sugary drinks and colon cancer risk. According to an analysis of data from the Nurses' Health Study number 2, drinking 2 or more sugar-sweetened beverages a day can double a woman's risk for colon cancer before the age of 50. Watch out for those sugar-laden beverages. They are not the best for us at all. Most of them contain 2 to 3 times your daily level of sugar intake just in one beverage, depending on who you ask or what references you use, but generally known that those are not so great for us, especially if consumed in excess and regularly, could cause some problems, and in this case, increase colon cancer risk. All right. The Journal of Sports Medicine and Physical Fitness in May 2021 looked at ballroom dancing. A study involving 20 older adults concluded that ballroom dancing is an effective form of exercise to help seniors meet physical activity guidelines. It's also a good activity for anybody. Dancing is wonderful. Chiropractors probably love the idea of dance because it forces your body, especially your spine, to move in ways that we might not use it the rest of the day, and reminding your body that it can move in ways that you don't use it most of the day helps it keep that movement throughout your whole life. So ballroom dancing, good idea. Dance every day if you can. The European Journal of Epidemiology, May 2021, looked at birth season and how it may actually affect dementia risk. Though the nature of the association is not understood at this time, a review of data from the Rotterdam study found that individuals born in the fall and winter months are 15% more likely to develop Alzheimer's disease or dementia than those born in the spring or summer. Interesting correlation there. Not much you can do about when you were born, but if you are concerned about your cognitive function, the health and well-being of your brain over the years, and you were born in the fall or winter, it may encourage you even more to increase those lifestyle factors and take really good care of yourself. Good to talk to your doctor, just as a reminder, if you're on any medications. Of course, recommendations in that respect fall outside the scope of chiropractic care because it's not what we do, but we do see people sometimes when they come in their health intake and they do have some symptoms, and sometimes symptoms can come from medications like higher blood pressure. So good to make sure you're reviewing with your doctor And sometimes pharmacists will catch it as well, just side effects from some of the medications you're taking and possible drug interactions and or interactions between foods, the medications you're taking, and even some supplements. So good to make sure that what you're taking is not only right for you and intended to do what it's supposed to do, but also to be cautious of any side effects that you should be aware of and or interactions. So always healthy to have that conversation with your healthcare provider. Finally, the sports medicine report from April 2021 looked at neck pain after a concussion and how that may lead to chronic symptoms. Following a review of data from 23 studies, researchers report that the presence of cervicogenic symptoms coming from the neck following a concussion are associated with up to a 6 times increased risk for developing persistent post-concussive symptoms. So with concussion, there's almost always a component of neck dysfunction, some kind of irritation to the parts of the neck, whether it's the soft tissues, connective tissues, and or mechanical structures like the joints. Good to make sure that with that head trauma, your neck is assessed as well. The outcome can improve when all those components are addressed together and nothing is left unchecked or corrected and improved. So if you know someone, especially in those contact sports, whether it's recent or even in the past, but wasn't maybe checked in that respect with the neck, good to go get it checked now so that the body can fully recover from that past trauma potentially. All right, that's your daily health update for Thursday. Thanks for being here. We'll send you a written format tomorrow on all the social media outlets. You can also find that on our clinic group page if you happen to be a patient. And we'll hope you have a great weekend. And we'll catch up with you on Monday with the next video daily health update as we do. Hope you're staying well. Enjoy the sunshine. Get outside and stay active. Take good care of yourself and those around you. And we'll chat soon. Bye-bye.